Welcome to Represents. Today's guest is Dr. Nick Nawabweze, the Fittest Doc. How are you, sir?
I'm very well. How are you? And you
Good.
actually did pretty well with that last name. I'm impressed.
Thank you. So you're a well-known family physician, a certified CrossFit and martial arts enthusiast, and you value the preventive power of tailored nutrition. So just to start with my first question, you went from engineering into medicine. So you have a background in mechanical engineering, and you went on to family medicine. How does your technical mindset influence your approach to health?
Um, that's a great question. I think ultimately and fundamentally, engineering has altered every part of my being in terms of, I before engineering, I thought a different type of way. After engineering, I still think the way that's a very nuanced and logical manner. And that's even through the College of Medicine. Personally, I would say that what engineering has done for me is just, I have to, I very much appreciate looking at things from a first principle standpoint. I think that all too often in this life, we come across people who reason and they think by consensus. And what I mean by that is they are, when it comes to their rationale for making a decision, it is enough for them. If enough people think one way, that's all they need to know. They'll say, okay, that must be the way to think because that's the way everybody's thinking. And I think that that is a frankly asinine way of approaching anything. I think a better way uh, is for you to gather the fundamental, the root knowledge necessary and to exercise critical thinking to the root to the root of the issue, to the root of the problem, and then it's essentially derive your way out of it, right? Derivative, to the extent where you're able to come up with a solution that you can rationalize and you can explain from every conceivable angle because you have actually you've thought about it deeply. So that's definitely an approach, a mental model, if you want to call it that, a mental model that has been imbued within me from mechanical engineering, and I've taken it through medicine and even with healthcare. That's how I like to look at things, right? I like to when it comes to a lot of the maladies and issues that we suffer as a society and as a people. I think that all too often enough physicians don't step back and ask themselves, okay, well, am I just going to prescribe a pill to subdue these symptoms, to relieve these issues that this person is having? Or am I going to ask myself, where are these issues fundamentally coming from, right? And that's called root cause medicine. It's something that I'm a very big fan of when it comes to, fundamentally addressing the root cause. And yeah, sometimes, listen, we don't know everything. I think one of the beautiful things about the human body, as opposed to engineering, with engineering, I think we legitimately know an order of magnitude more than we know about the human body. But I think with the human body, there's still a lot that is unknown. So I think, yes, can you do root cause medicine with absolutely everything? No, because to contend that, to assert that, would also be to assert that we know everything that there is to know about the human body, and we simply don't. But I think that enough is known, especially with common maladies, right? If you go to the CDC's website and you look at the top 10 killers in the United States, from things like cardiovascular disease, heart disease, diabetes, cancer,
Hmm.
there are a number of issues that when we back up and we ask ourselves, okay, well, this seems to be very common within the population. Do we know the fundamental reason why these things are happening? For a lot of these things, we absolutely do. So personally, I've never been a fan of just, hey, give somebody some metformin, give somebody some medication at the very onset of at the beginning of a diagnosis when they are not end stage, right? They are very early stage. Usually, you have a very you have a good chance, if the intervention is correct, you have a good chance of reversing whatever the disease process is. And I think that all too often, way too many doctors are like, okay, let's just give pills, let's give some medications. When instead, if they were to think about things on a deeper level, they would say, okay, let's figure out what the root cause is. And oftentimes that is, unfortunately, elements of their lifestyle, which people may not be aware is, the causative etiology, but it fundamentally is, right? So yeah, that's a super long-winded answer to your question.
No, no, no. That's great to hear what you have to say about it. It actually leads me to what I heard you say recently in a podcast. In a podcast, you said that sick care and health care are not the same thing. Can you elaborate on this a little bit?
Yeah, I think that ultimately sick care is what the healthcare system in this country, and by this country, so I live in the United States. So
Hmm.
in the United States, that the healthcare system is mostly directed and mostly focused on sick care. So much so that if you back up and you ask yourself, okay, why are there so many more hospitals? And why are hospital systems here in the United States so large, while at the same time, primary care, which for the most part focuses on prevention, and we do focus on other things, but we do have a strong component of preventative medicine. You- so hospital systems are getting so large, yet clinics are having issues with having patients and having a large enough patient base and having patients come to them consistently. And you have people who seem to brag about not having a primary care physician, as if they do not realize that the primary care physician is there to, in all respects, keep them healthy, or at least idealistically, we're here to keep you healthy. Sure, I know for a fact I am not myopic. I don't believe that every primary care doctor practices like I practice or thinks like I think. But I would say, when viewed as a monolith, which we may not necessarily be, but when viewed kind of from a 30,000 foot view, primary
Hmm.
care physicians are focused on prevention, right? So why is it that primary care physicians are finding it hard to find patients, yet our hospital system is just bustling and making more and more money every year, and hospital beds are full. And if you back up and you look at it, then you realize, okay, well, the reason why that's happening is because medicine and healthcare in our system is more reactive and not proactive. We're not
Hmm.
preventative focused. We're focused on, hey, let whatever happens, happens. Hey, if somebody, I don't know, if you have whatever symptom someday that's concerning, okay, well then you can go to your doctor, or then you can go to urgent care, or then you can go to the hospital. Um, so, when you ask yourself, okay, well, realistically, is that a healthcare or is that sick care? That's what I differentiate as more so sick care. And I think healthcare is instead the combination of things that you can do from a holistic and preventative standpoint. And oftentimes these are the common and deliberate and daily choices that you make in your life, whether that's your sleep, your nutrition, your hydration, given how much of our body is made out of water, your exercise, your familial and friends connections of friends, right? Given the importance of social circles when it comes to human beings and our mental health. All these things, and there are obviously other things I haven't mentioned, but all these things play part and parcel of healthcare, right? And keeping us healthy. And, I think that that's an important distinction because, a fundamental, some people, some doctors may not believe in this, what I'm about to say, but I think a fundamental ideology that I have is that the human body has multiple mechanisms to keep us healthy, right? And to keep us away from sickness. Uh, so much so that we could essentially heal from daily insults. I remember just going through med school and learning all that I learned about the human body. I was fascinated that it's almost like, whether it's here's a good example. You and I, Ray, we don't have to suffer from sunburn, right? Or maybe we haven't maybe you haven't suffered it often. I know I haven't, but not with my skin. I don't ever get sunburned. But here's the thing: people who get sunburned, don't you find it amazing how they get sunburned and that skin over time it will heal, it'll get back to normal, and then their propensity to get sunburned over time, especially with a consistent and correct amount of exposure, their propensity to get sunburned will actually decrease. So what does that tell you if you back up and look at it? It tells me that the human body, like we literally from across many different systems in our body, we are built to heal ourselves. We are built to recover from insults, to recover from damage. Now, here's the nuance: that damage cannot be a massive damage. If it's a massive damage, if the damage is too large, you cannot compensate for it. Your body cannot compensate. You will die. If the damage is small enough, and you give yourself the chance to recover on a day-to-day basis, then yes, you will recover, you will survive. So, if you understand this mindset, then you also understand that, okay, well, giving yourself the ability to recover on a day-to-day basis is absolutely crucial. We cannot live a life where we are ingesting insults and imparting insults onto ourselves, and we just think, oh, we can take it, let's keep doing it. Here's another example, right? I'm having random examples of the physiology pop into my head, but cigarette smoke. You and I'm sure you're not a smoker, I'm not a smoker, but if you walk through a crowd of smokers, people who are smoking, and you have to inhale that, I'm sure sometimes you've walked through a crowd of smokers and you've gotten annoyed that you have to inhale that. Guess what? There are these things called alveolar macrophages. So in the smallest unit of our lungs, in the alveoli, there are macrophages that can quite literally. So I'm sorry, macrophages are immune cells, so they can quite literally gobble up that contaminant of that smoke that you just inhaled and essentially nullify it. Essentially nullify, completely negates the harmful effect of that smoke. But as you can imagine, that's me and you walking through a crowd of smokers. Now, if you're not that person walking through a crowd of smokers, but you're instead that person smoking 10 times, smoking a cigarette 10 times a day, what are you really doing? Now you're not just taking in that smoke on a one-time basis as you walk through a crowd, but instead you are consistently imparting insult after insult after insult, compounded over months, compounded over years, compounded over decades. And then obviously, God forbid this happens, but if we want to be realistic, this happens. Uh, People will then be diagnosed with any number of lung cancers. And in reality, they did it to themselves because they consistently imparted an insult to their respiratory system. So
Mm-hmm.
this all loops back to what I was saying. The human body, we are designed to heal ourselves. However, we are not designed to heal ourselves if we are putting ourselves consistently in an environment that is damaging to us. We have to, if we want to put ourselves in that damaging environment for a little bit, okay, that's fine. Here's another example: processed food and just eating garbage. If you want, I'll never tell a patient or a client of mine, you can never eat that cake, you can never eat that garbage. No, it's okay, because guess what? That's an insult, but that's an insult that's just one time. You're imparting some any degree of injury to any number of the systems in your body, but you have an ability to recover and to heal. But if that's what you're doing every single day, and you're eating that crap every single day, that processed food every single day, and you're negating the power of your sleep every single day, and you're just not doing what you should be doing, then it's no wonder that you're going to eventually succumb to sickness, to any number of illness, to any number of maladies, right? We're not robots. We're not AI. We're not machines. We have an ability to come back from damage, but it's a limited ability. And I think that, to me, that's something that I always keep in my mind.
Okay. This leads me to this topic here. I know we live in an era that's focused on body positivity, right? So how do you balance promoting fitness with fostering a healthy body image among your clients?
Data.
Hmm.
Data, yeah. because you got to understand that the body positivity debate is really one of emotions. It isn't one of objectivity, because how do you argue objectivity? You can't argue data. You can argue assessment and interpretation of data, but you can't argue raw data. So if somebody's trying to tell me, okay, hey, body positivity this, body image this, with my patients and my clients, I'm as a doctor, even though I have this brain that I have as an engineer, I'm still empathetic, and I can understand how people feel, and I can put that into my making matrix as I talk to a client or talk to a patient. But ultimately, when I do talk to my patient or do talk to my client about something in this regard, I am very objective, and I say, hey, here are the numbers, right? For example, your waist to height ratio has an intimate relationship with your with your life expectancy, and how many years of life you will lose for every absolute increase of your waist to height ratio over approximately 0.47 to zero point 0.5. So what does this mean? This means that if we were to look at this, let's put some numbers on this. If somebody has a 50-inch waist and they are 6 foot tall, right? So that's 72 inches. So if you do the math, 50 divided by 72, 50 divided by 72 is 0.694, right? So what did I just tell you? That anything over zero point 0.5, you are losing years of your life objectively. This is the data, right? So I'm not telling my clients or my patients, hey, I want you to feel good about yourself. And because of that, I'm going to avoid telling you the truth, and I'm going to avoid, uh, conveying to you what the research says. No. Instead, what I'm telling people is, these are the numbers. This is what the research says. And then I'll sit back and I'll let you, in your mind, come to whatever conclusion you want to come to. Why do I do that? Because let's say that number that we just brought up, 0.69, let's say we look at the research, and on average, that somebody with a waist to height ratio of 0.69 has taken off 8 years of their life. Who am I, as somebody's doctor or as somebody's coach, who am I to say that you should want to prioritize saving that 8 years of your life, as opposed to living life as you want to live currently, and whether that's waking up every day with all your joints hurting, or not being able to toss your kids around in the playground because you don't have the degree of physical fitness that is a requisite for that. Who am I to tell you that you should change your life and improve your health and get those 8 years back? That's not within my purview, right? It's actually disrespectful of me to assume that you would or should want that. But it is not disrespectful of me to share the data with you, to share the number, and then to share what the research says, and let you feel what you want to feel, right? So that's how I tend to kind of thread the needle with such a complicated topic as the body positivity movement, right? I do kind of something that I've said before that I'll double down on, is that you actually, so the health at every movement, or the health at every size movement, I actually agree. You can be healthy at every size. However, you cannot be healthy at every body composition. And what do I mean by that? There are men, I'm sure, who are 300 pounds. So, by objective definition of their size, they are very large individuals. And then I could do any number of testing on them, look at their biomarkers, etc. And per the testing, they are just, it almost reminds me of that one guy from Game of Thrones, that 7'5" guy, right? I'm sure that man is 300 pounds. And what's to say that I can't test him and he is just top percentile across the board, and he's super healthy. So technically, yeah, he's healthy at a size of 300 pounds. However, if we were to flip the script and not talk about him, and now we're talking about a 300-pound man who has a waist circumference of 60 inches, right? Who has prolific metabolic dysfunction apparent on his labs, who lacks the functionality that he wishes he had in his life, lacks the ease within his body that he wishes. Instead, he's sore every day. He's in pain. He feels that he lacks mobility. Guess what? That same person at 300 pounds, but at a completely different body composition, is not healthy. So yes, it is possible to be healthy at every size. It is not possible to be healthy at every body composition. And I'm not going to sit here as a doctor, in as much as I am a doctor who cares for his patients and cares for his clients. I've always been the type of person who I refuse to lie to somebody to make them feel better. And this isn't just for medicine. This is just me baseline. If that makes me an a-hole, then I guess I'm an a-hole. But I'm not gonna sit here and blow smoke up your butt to make you feel better, when the truth is something that you should be hearing, and the truth is something that other people not sharing with you is actually, over the long term, damaging to you and damaging to your future. So that's kind of how I address it.
That's amazing. So through data, you're able to tell those clients the truth, basically. And I'm wondering if a person in your position, obviously looking the way you look, if it's easier to hear the truth from a person who looks fit like as you do, right? So can you
That's a
just
great, yeah, absolutely. Let me answer that. They've actually done studies on this. They've done studies that show that physicians who do not live the lifestyle, doctors who do not live the lifestyle that they purport to their patients, that they encourage for their patients, those same doctors are actually much less likely to make those same recommendations. And why? It's simply, this is human nature. This isn't just medicine. This is human nature. We don't want to appear to be hypocrites. We don't want to be, most people, right? Especially people who are well socially calibrated. They don't want to say something. And then, once the lens is turned back on them, it's clear that they are not doing what they say. And this is, like I said, irrespective of medicine, just across the board with human social interaction. So yeah, I think that that's a really great point. That unfortunately, especially when you consider the landscape of medical doctors, the landscape of physicians who are just not representative of the pinnacle of human health, who are making recommendations to patients that truly they have, or truly that they honestly cannot be making, because it's clear, sitting across from them, that they are not following what they preach. And I know this as a fact, and not just from the data that I just shared with you, but I cannot tell you how many times clients have reached out to me, patients have reached out to me, and have literally overtly told me to my face, hey, I want you to be my doctor, and I appreciate you being my doctor, because the last person who was my doctor, they would give me advice, and it was very clear that they were simply saying one thing and doing the other. It's almost like what's that one thing, do as I say, not as I do. Nobody
do?
likes nobody likes listening to somebody like that. So I think that that's a powerful thought that you brought up, and I can tell you that it absolutely is reflective of reality, at least from what I've seen, and it's concerning. And I think another reason why it's concerning is, if you think about it, from I don't think that there's anybody. Listen, when it comes to healthcare, every single role I think is important. Respiratory therapists, physical therapists, everybody in every different field is important. But I don't think that any other field can truly contend with, whether we're talking osteopathic medicine or allopathic medicine. I don't think that any other field can truly compete with, can compete with all the things that you have to learn about the human body as a doctor, from a comprehensive and holistic standpoint through medical school. I mean, we are just put through the burner, and you have to keep up or drown, right? 18 to 20 hours study days consistently. over many years. But I'll tell you what that gives you. Ultimately, what I felt that it gave me is it gave me a lens to look at the human body and understand how to not just maximize the health of my patients, but maximize my own health. So as you can imagine, Ray, I find it personally very difficult to understand when I'm looking at somebody else who's a medical doctor and they are the antithesis, the literal antithesis of the of health, right? Of the pinnacle of health, of what they should be. It confuses the hell out of me because I'm looking at them. I'm like, this makes no sense to me. You went to med school. You learned everything that you have learned about disease and about not just about the human body in a healthy state, but also about pathology, about disease. Yet, even with that, I can look at you and without a shadow of a doubt say that you are not the fittest version. You are not the peak healthiest version of you. How does that make sense? It's almost like you have all this knowledge about all that is at risk and all that can happen to you from a disease standpoint, and even with all that knowledge, you haven't managed to put a plan together for yourself to mitigate risk and to stack the deck in your favor as it pertains to your health. Yet you want me to believe that even though you haven't done those things for yourself, who is technically, I mean, even as a doctor who wants to help people, you still like survive. You want to do what you can to survive, right? You don't want to just sacrifice yourself for your patients and die. So if that's the case, okay, well then shouldn't you be representative of whatever ideology you feel that you want to convey to your patients? Shouldn't you be representative of that? Literally doesn't make any sense to me when I see doctors who are not fit and who are not healthy themselves.
Yeah, basically be the change you want to see in the world, right? Be the example.
Absolutely. Absolutely.
Yeah.
Absolutely.
So tell me, Dr. Nick, as a black doctor, in the US, what unique challenges and opportunities have you encountered in the medical field?
What unique challenges and opportunities have I encountered in the medical field?
Hmm.
Um, I think that ultimately, have I come across patients who I pick up on the subtext, who I pick up on nuances of body language, both nonverbal and verbal alike, that they may have some discriminatory thoughts about me? Yes, I have. But ultimately, even with patients like that, I've always been very focused on, hey, just do my job. Now, if that person crosses the line and says something disrespectful, then nothing says I need to continue being their doctor, and I certainly don't have to take it. I'm not going to just sit here and just take you being disrespectful to me while I'm trying to help you. No, that will not fly. Absolutely
Has,
not. And I
has that
and
happened?
I it's happened once or twice, especially in residency that I can remember. And I remember there was one lady. I remember she was being disrespectful to me while her dad, who was the patient, was in the room. And I remember that I got up from the patient couch in the room and I walked to the door of the patient room and I closed it. And I literally told, like her dad was sitting there, I literally told the daughter to her face, listen, I'm here for your dad. I'm not here for you. Basically, I can't remember exactly what I said, but I basically told her, I'm not going to tolerate any degree of disrespect from you. If you want to disrespect me, you can do that. But then nothing says that I am obliged to continue to be your father's doctor. I can sign myself off of this case and get another doctor in here. And if that's what you want me to do, I can absolutely do that. But if you want me to remain as your father's doctor, there will be a level of respect that you convey to me as I convey to you. Because I know I'm not going to be disrespectful to you, but that needs to be a reciprocal interaction. And if it's not, then I don't need to be here anymore. So yeah, I mean, I've had some cases like that happen, but I also do believe that in as much as I've had some overt cases like that, I think that, yeah, you know as well as I do, these things, especially in this day and age, they're usually not overt. If it happens, they're usually very covert. So, when it happens, it happens. I believe in those cases, I'm just going to just do as good a job in whatever the interaction is. I'm going to do as well a job as I can and let the chips fall where they may. But ultimately, I've always been a believer of number one, you can't change the world. You cannot change the universe. None of us are God. We're not powerful enough to do that. We can only change ourselves. If you believe that, and then there's another fundamental belief I have that drives my thoughts and drives my beliefs and drives my actions, and that is that you can't blame others for your circumstance. The moment that you're put in a position for whatever reason, and you start to blame others for whatever happened, what you're doing, whether you know that you're doing this or it's entirely unbeknownst to you, but you're actually giving them the power and taking the power away from yourself. Because
Hmm.
if you tend to blame yourself for everything, you're also doing something else. You're giving yourself the power to change that same everything. The moment you blame yourself for everything, you're telling yourself you can change those things. The moment that you blame somebody else for something, you're essentially saying, I can't change this. It's completely out of my control. So I would rather, even in cases where the blame is clearly not mine and can be assigned to somebody else, mentally, I still find a way to blame myself, just because that then puts the power back in my hands and means that I can do something about it. So personally, when it comes to race in medicine, I mean, is it always going to be a factor? Absolutely. Do I care at all? Absolutely not, right? Because I'm going to find a way to win. Like, that's just how I am. So, yeah.
That's awesome. Listen, as my last question, I want to ask you, as we look ahead, what emerging trends and technologies in healthcare are you most excited about, and how do you see them shaping the future of wellness and patient care?
Uh, that's a great question. So I think, more and more, it's becoming clear to the medical world how important metabolic health is, and how large a part metabolic dysfunction plays to many, 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 many disease processes. So I'm very excited to watch the research on that continue to evolve and become more and more expansive, and essentially increase the ability of people to really take charge of their lives, not on the basis of just taking medications every day until they die, but on the basis of uh, changing things such that their metabolic health is maximized and improves, and they can live a life full of vitality. The second way I would answer that question is something I'm also very excited by, and I think everybody has seen. I think the Fitbit was the first one on the scene, but since the Fitbit, there have been many, many other kind of consumer wearables and technologies that have come to fruition and come to bear. And I think that is something I'm noticing more and more. Right, you're having hospital grade or near hospital grade devices and technology become available to consumers. Things that you can wear, things that you can implant into your shoulder for a degree of time. Things that even they have. I don't need to name the brand, but they have bed liners that you could put on your bed these days that can, modulate the temperature of the bed and track a number of your vital signs, your resting
Mm.
heart rate, your body temperature, and all of these different things. In my mind, they give the power to the patient, and they give the power to people simply because it quite literally gives us insight into numbers and data and vitals that in the past only your doctor would have in the doctor's office. For example, here's a really good example. Let's say we were to snap our fingers, Ray, and go back 30 years. You wouldn't know. People would not necessarily know, hey, what is their resting heart rate? What's their lowest resting heart rate for the day? Or what is their resting heart rate trend over the last 30 days? Instead, if they wanted to know data like that, they would call up their doctor and they say, hey, doc, 2 months ago when I was in the office, what was my resting heart rate? But that's the thing, that data is 2 months old. These days, you have any number of devices that are on your body that are essentially tracking all these things and trending them with respect to time. And then you have access to this data on yourself. This isn't population wide data. This isn't saying, hey, in some study of 30,000 people at this age, the average heart rate was blah, blah, blah. No, this is saying on you, Ray, on you, Nick, this is your resting heart rate. This is the trend of your body temperature. I don't know, over the last week, right? This is your heart rate variability over the last 3 months. This is the trend of it in that 3 months. I'm just bringing up a couple of examples, but the fact that
Mm-hmm.
there are so many of these different um, vitals and so many of these different data points on you and on your respective physiology of one person, I think that gives you an incredible amount of power that doctors 30 years ago did not have. You ask a doctor 30, even skip that, even a doctor today, you go into your doctor today and you say, okay, hey, Doc, what's my heart rate variability been like over the last month? What's my resting heart? Is my resting heart rate trending up, trending down? So the combination of resting heart rate, Ray, and heart rate variability tells you a lot about somebody's autonomic nervous system and their degree of stress, and to some degree, their degree of fitness and health. So those are actually the combination of those two are very important. Resting heart rate, HRV. The fact that you cannot go into any doctor's office and ask them that, and they'll just be able to tell you from their point of care assessment there in the office, they can't tell you that data. But with certain wearables, with certain devices, you can absolutely procure that same data and trend it in yourself over time, essentially
Mm-hmm.
giving you more power than your doctor in that circumstance. And I think that that's incredibly powerful for keeping people healthy and for emphasizing preventative healthcare, as we talked about earlier.
Perfect. Dr. Nick, I'd like to thank you for your time. It's been very informative. I like to end my conversation as saying, we learn today and we lead tomorrow. Thanks again for your time. I appreciate you.
Absolutely, I appreciate you. I thank you for so much for letting me come on and speak to your audience. And so Ray, everybody found me on Instagram. So my Instagram is just all one word, the Fittest Doc. And I'm also on YouTube, on Facebook, even though I don't post on those places as much as I do on Instagram. And then my website. Actually, do you put the website in the show notes, Ray, or do you want me to
I
say it
will I
here, or
will
what would you
actually
like?
add all your information on there, but you can go ahead. That's fine too.
Okay, okay. So anyway, so my website is just all just it's just thefittestedyou.org. So www.thefittestedyou.org. I do offer a free nutrition masterclass on my website that you can click on. If you scroll down and you click on a green button that says "Get my free nutrition masterclass," you can do that. I also have a community of people who I lead, but I'm also one of the community, right, of people who are very fixated and centered on maximizing their health and minimizing their chance of disease. And there's a lot of teaching in the community. I have a lot of video courses, and I put out a lot of resources for people who are interested in staying away from disease and staying healthy. So we definitely love, anyone who wants to join. We'd love to have you.
Amazing. Thank you very much.
Absolutely.